Hey y'all, it's Nikki. I have to tell you about Tecovas boots. I finally have a pair, and they are handmade, high quality, stylish, comfortable, and I even got them customized with leather stamping. So go get yours at the Tecovas flagship on South Congress or their store at the Domain. Plus, good news, Tecovas is opening a brand new store for your Western wear needs on Main Street in Georgetown. Swing by for their grand opening party September 27th through 29th for live music and freebies for the first 50 of y'all to get there. So come shop with me at Tecovas. That's TECOVAS.com. Don't go gently, y'all. Today on CityCast Austin, there's a new COVID vaccine out now, and the FDA recommends it for everyone over 6 months old. So we're revisiting a conversation we had last month with Dr. Desmar Walks, the medical director of Austin Public Health, all about this latest strain of COVID. It's also flu season, so while you're at it, you may as well schedule that one too. It's Tuesday, September 17th. I'm Nikki Devon, and this is what Austin's talking about. I am here with Desmar Walks, the medical director at Austin Public Health, and we are going to be talking about COVID. Thank you, Dr. Walks, for being here with me today.
Thank you for having me.
We at CityCast know quite a few people with COVID right now, or people that have recently had it. I recently had it. People say stuff like, it's back. COVID is back. But I kind of feel like it never left. So what is the reality? What's the latest with COVID in Austin?
So yes and yes.
Yes and yes.
It never left. It's been waiting in the wings to, for those of us who have been vaccinated and have immunity, where we may have missed that second chance or third chance or whatever of getting it. But for those whose immunity is a waning, and they're not quite as able to fight off the infection as they may have been right after they got that vaccination booster shot, those are the people that are going to be affected. And we're talking about those individuals who are older, or they're on some kind of medication that lessens their immunity. Those individuals are going to be more susceptible to acquiring COVID at this time. We have been the CDC is continuing to monitor the variants that are circulating in our community. And we have a variant of Omicron. They're going to put that into the new booster, just as we do for our flu vaccine every year. They see the winter months stuff that we see earlier, so we look to that to see what we're planning for our flu vaccines is going to be covering what we're anticipating to be circulating here in the Northern Hemisphere. And that's how we look at formulating our flu vaccine. And right now, because we're dealing with COVID, we're doing a similar thing. And we see that it's a particular type of COVID variant that's in the Omicron line causing infections right now.
Now, you called it the Omicron, but I'm hearing this very cute name called the FLiRT variant.
Yeah.
I'm like, that y'all just trying to make it sound cute.
We've been changing names a lot, which I think is probably confusing to the community. Not confusing to those who get COVID and feel its effects. It's COVID.
So are you seeing a lot of spread right now?
Yeah, anecdotally, we're seeing people that are coming down with COVID. It's not reportable, so there are people doing home tests, and we're managing our surveillance with different tools now, in that we're looking at what's being reported to the Department of State Health Services. And there has been an uptick in the number of cases, but that's expected at this time of year as we have people traveling, we have more gatherings. We anticipate that as kids get back together and start congregating, that we're going to see an increase But on the Department of State Health Services site, we are seeing an uptick in numbers of cases as well. So
I also, as a part of the effects of my COVID, I got a pulmonary embolism, and so when I was talking to the people at the hospital, whatever, they were saying that like sometimes with every new strain comes new symptoms, new like results. It feels like we're still learning about COVID, and every time something new comes up, it's like, oh, okay, now there's this. Great, now we have this thing. Are any of the symptoms new for this one?
you're still seeing aching, fever, extreme fatigue, sore throat is common, congestion. Some people don't have any symptoms at all, and find out through testing when somebody else that they're living with may have it.
Yeah, that's how I found out. Yeah.
Yeah. But throughout the duration of COVID, we've had people have clotting problems because it does affect our clotting system.
It's good practice in general if you're going to be in a large crowd, especially inside, to just put a mask on. You know what I mean? Like, especially in times like right now where there seems to be a little bit of an uptick. I mean, it seems like a silly question, but like, do you feel like that would be helpful?
So masking, as you know, is a real hot button discussion.
Yeah.
But you're right. It's something that gives you that extra layer of protection. By all means, if you're in a crowd of people and you don't know who in that crowd might be coughing and sputtering and sneezing on you
Oh, God.
without covering their mouth. Having a mask on now is socially acceptable. So avail yourself of that opportunity to protect yourself.
Yeah. You started here in Austin 1 year into the coronavirus pandemic. How has it changed since then?
I think we understand as a community that when something like this is happening, that we can protect ourselves and our loved ones by getting vaccinated. We can protect ourselves and our loved ones by using a mask if you're not vaccinated and in a situation where there's poor ventilation, so that you don't go to the family dinner indoors and get your grandmother sick. Those are the kinds of things that I think before at the outset, we didn't know what we were dealing with. There was a large learning curve, not only for the general public, but for medical professionals and public health professionals who were working so hard to protect everyone.
In my brain, it's like you get a vaccine, it lasts a year, and then you get another vaccine, but that might not be how it works. How long do they last?
It depends. It depends on the type of organism that you're vaccinating yourself against, and it depends on how that organism, in this case, the virus, behaves, because given the opportunity to thrive and survive in a host human being, that virus can, over time, start to mutate. And with those mutations or changes in its genetic structure, it develops the ability to either spread faster or cause more severe disease. It depends on where the change happens. And so that's why you saw during the pandemic different times when we had, say, during Delta in June, July timeframe of 21, we had a virus that was super spreading in its capability, and it was also causing more severe illness. And so contrast that to January of 22, when we had Omicron, and it was a fast spreading virus, but not causing a severe disease. So there are so many variables that impact how people respond to being infected. And so those things come into play with how well the vaccine or how long the vaccine is able to provide that protection.
When it first started, I got my boosters and it had to be this huge big deal. But now like last year, I got my flu vaccine and my COVID vaccine at the same time, and it was super convenient. And so I'm curious as to whether or not you think that this is just kind of going to be what it is now. If you're getting vaccines, you get the flu, you get the COVID.
Yes, that's going to be the way we do it. It's like one of the list of things that, go get your groceries, go pick up your prescriptions, whatever, and go get your shots.
Yeah. Let's hope so.
We want to keep being able to go to work. We want our kids to be able to go to school. We want to be able to, enjoy holidays with family and friends, and make sure that the people that we're around that we love and enjoy spending time with are not going to be sick because of something that we bring to the party besides the covered dish, so we need to go get those shots.
Are there any other diseases for kids that parents should be aware of?
The thing that we're concerned about right now is measles, because we're seeing a resurgence of measles as a result of kids getting behind on their vaccinations, immunizations during the pandemic. And so the MMR, mumps, measles, and rubella vaccination that kids typically get as part of their childhood vaccine series is something that we encourage parents to make sure that their children are getting. And so that's one of those things that is, you'll see a lot of advertising being done on, and when you go to your healthcare provider, they're going to be talking to you about it, I'm sure, as well.
Wow. Okay. Now you have to forgive my ignorance, because I legitimately thought measles was like an old school disease. Are we seeing any in Austin, or is this just in general things that we're trying to make sure we're on top of as a whole?
We've had some suspected cases of measles. Here in this country, we had declared measles as being conquered by vaccine.
Oh my goodness. I'm just incredibly embarrassed by the fact that I did not know measles were still around.
Don't be.
Just in case there are any listeners that are like me and thought measles were kind of like this thing that people used to get. Can you just quickly tell us what measles are? What do measles do?
So measles is a virus. It's highly contagious, spreads quickly. And it can cause runny nose, sore throat, fever. It can cause a rash, a red rash that spreads over the body. And it can cause white spots inside the mouth. And it can, in some individuals, cause severe enough illness to require hospitalization and even cause fatalities.
Can adults get measles?
Yes, they can. If they're unvaccinated or under-immunized, yes, they can.
Okay.
Or if if their immunity is decreased because they have cancer or taking some kind of medication that lessens their immune response. We weren't seeing a lot of cases, and recently that has changed because we have people that are traveling into endemic areas, places where measles is still a problem, and then coming back and bringing a souvenir they don't want. And so right now, our push across the country is to make sure that our children and those who are under-vaccinated get vaccinated so that we can avert having a problem with a measles outbreak.
I know that you studied racial disparities in healthcare. And, from a Black perspective, I know that still, even now, years later, there's a lot of distrust when it comes to the vaccines and boosters and information. And, I can't imagine that Black people are the only people that don't that don't trust. You know what I mean? Are you seeing kind of the same thing, this like general distrust? Or do you think that's getting better?
If you take the time to explain how much care and attention and how much research has been done to make sure that we're doing the next right thing in this arena, that people come around. You don't always get the right information when you're looking at what's running on social media, unfortunately. And so I think talking to a healthcare provider that you trust is a good way of getting that information, and making sure if you're looking at and researching things for yourself that you use a reputable source like the CDC or the FDA, or so that you can be sure that what you're hearing from whatever source other than that is verified and true.
Are you guys doing anything in public in general to inform people and to help people find testing supplies and like masks and stuff in Austin? Do you guys have anything like that on your website or anything?
As of recently, the funding has changed since the public health emergency ended. So the distribution of free tests that was going on before during the pandemic is no longer available.
When someone's funding changes, then that means it trickles down, unfortunately, to the rest of us. And you have to be more aware and diligent yourself.
I think that what we need to remember is there may be some things that fell off the radar during the pandemic because for a time we weren't going out and doing things, weren't going to a clinic. We may have forgotten to get our mammogram. We may have, what about that colonoscopy?
Yes.
Maybe just having your checkup in general. All of the things that we did pre-pandemic that were routine may have dropped off the to-do list. And so I think it's important for us to take a look at that to-do list, make sure that we're taking care of ourselves and getting those things back on.
That's the best advice. Just like not forgetting about your routine checkups, not forgetting about the things that we are supposed to do, and getting kind of like tunnel vision about COVID or tunnel vision about the flu. Is there anything else that you want everyone to know that we haven't covered? Did I miss anything?
One of the things that we don't always put on our list of what's healthy and important is our mental health. And I really believe that if you're finding that your joy isn't there like it was, it's worth talking to somebody about it. Others who are close to you may have noticed it too. And if you don't feel comfortable doing that, talking to your provider about, just getting a screen and seeing if there's something there, just to address that earlier. And not only for yourself, but for those of us who have children, checking in with your kids to see how they're doing.
Fantastic. Dr. Walks, thank you so much for being with me today and talking with me about COVID and the measles and how terrifying they are. Thank you for being here.
Thank you. Thank you so much, Nikki. I enjoyed it.
That's all for today here on CityCast Austin. You can find information on where to get your vaccine in Austin in our show notes. If you enjoyed the show, why not tell a friend, rate the show, leave us a review, and subscribe to our Hey Austin newsletter. We'll be back tomorrow morning with more news from around the city. Bye, y'all.